Hello, dear all, namaste. In this video, I will be discussing about the X-ray of nose and paranasal sinuses. The different types of PNS X-rays are occipital or Waters view, which is the most commonly performed X-ray, followed by occipital view with mouth open, which is also called as PNS view. Next is AP or fronto-occipital view, that is caldoid view, lateral view, lateral oblique of the orbit, that is ridge view, and submental skull base view. But in routine clinical practice, we only perform occipital and occipital with mouth open, that is Waters and Peary's view. Why to perform the X-ray PNS? We perform X-ray PNS to look for the sinus opacity. We have to always compare to the ipsilateral orbit for opacification. If the sinus is less opaque than the ipsilateral orbit, then it is not sinusitis. Look for the frontal sinus scalloping. Usually the frontal sinus is scalloped. It may be absent in mucocele of the frontal sinus. We do X-ray to look for dome-shaped opacity in the sinus, convex upwards or concave upwards. Look for the bony opacity like ostium of the frontoethmoid sinus or frontal sinus. Look for the fracture nasal bone or orbit. Look for bone destruction or malignancy, and look for the radio-opaque foreign bodies. But as like the X-ray of the mastoids, the X-ray PNS also has largely replaced by CT scan of nose and PNS. This is the most commonly performed investigation for nose and PNS conditions nowadays. This is the X-ray of nose and PNS, plain Waters view. We can see the lamina papyracea here. First we have to look for the orbit. This is the orbit, right, left orbit, and we have to compare the opacity of right maxillary sinus in relation to the right orbit. Right frontal, right orbit is normal. This is lamina papyracea. This is the left frontal sinus. This is the orbit, and this is the left maxillary sinus, which are normal. This is the nasal septum. This is the nasal bones. Therefore, this is plain X-ray of nose and PNS, not only nose, right? In the exam, just tell this is a plain X-ray of nose and PNS. This is the reference mark innominate line, IL, which is the mark produced by the greater wing of the sphenoid bone. Next is, what are the important anatomical landmarks for X-ray PNS? They are frontal sinus. We should look for the scalloping of the frontal sinus, maxillary sinus, ethmoid air cells, sphenoid sinus, which is seen through open mouth, and middle wall of the orbit, lamina papyracea may be breaching there, and innominate line, which is found by the greater wing of the sphenoid bone. This is the plain X-ray of nose and PNS Waters view, and first we can look on the orbit. They are the big cavities, and we have to compare the haziness of orbit with the sinuses. So this is the right maxillary sinus. Compare with the right orbit. This is normal. Left maxillary sinus with the orbit. This is normal. Always compare ipsilateral orbit and the maxillary sinus. Sometimes if the view is slightly tilted, then this may mimic sinusitis. This is a frontal sinus with the scalloped margins, which are normal. Scalloping may be absent when the patient is having mucocele of the frontal sinus. This is lamina papyracea, and you have to look for the ethmoid sinus medial to lamina papyracea. And this is the septum, nasal septum, which is thickened, and there is DNS to the right side in the upper part, that is high DNS, high deviated nasal septum. Now, what is the best X-ray for sinuses? For the maxillary sinus, occipital view or Waters view is the best one, which shows both the maxillary sinuses. And frontal sinus, AP view or calvary view is important. Ethmoid sinus, lateral oblique or ridge view. And for the sphenoid sinus, submentopartical skull base view is important. But most commonly performed X-ray is only OM view, that is occipitomental view, and sometimes occipitomental view with mouth open, also called as PNS view, to look for the sphenoid sinus. As already told, all these X-rays have been largely replaced by the CT scan of nose and PNS. The commonest view is the Waters view or occipitomental view. The structures within here were already described in the previous slide. Next is Waters view with mouth open, that is PNS view. You can see the sphenoid sinus through the oral cavity. Rest is same. Now coming to different pathological conditions. What is the finding of X-ray PNS in acute sinusitis? In acute sinusitis, there will be pus collection in the maxillary sinus. So it shows air fluid level that moves with change in the position of patient's head. So we can see concave upwards opacity. What is the reason for concave upward opacity in acute maxillary sinusitis or fluid in the sinus? This is due to capillary action of the walls of the maxillary sinus. There is soft tissue and this has capillary action or imbibition. This leads to concave upwards. The sides become slightly raised. So this leads to concave upwards, may be asked in the Viva or X-ray. In chronic sinusitis, the X-ray shows homogeneous opacity involving bilateral or multiple sinuses. So this is chronic sinusitis and patient is having DNS here. Probably patient is also having some form of atrophic rhinitis here. The next question is, what is the differential diagnosis of unilateral maxillary sinus opacity? In this X-ray, you can see the right opaque maxillary sinus in comparison to right orbit. So this is most commonly in acute maxillary sinusitis where the pus has filled the maxillary sinus. When there is air fluid level, it will be seen as air fluid level. When there is large amount of pus, that will be seen as the complete maxillary sinus opacity. In case of chronic maxillary sinusitis, there will be thick mucosa. The mucosal edema also leads to features of complete maxillary sinus opacity. Fungal sinusitis is the most common cause for unilateral complete maxillary sinus opacity. Enterocanal polyp also simulate unilateral maxillary sinus opacity. Maxillary mucocele, maxillary enterocyst, big cyst, hemointrum following trauma, and malignancy also can lead to unilateral maxillary sinus opacity. So sometimes you can see enterocanal polyp in PRS view. And this is the enteral part of the polyp and this is the choanal part, which is a big polyp hanging in the oropharynx. So you can see like this. This is seen in cases of enterocanal polyp, which is less common finding nowadays, and we use CT scan when you see this type of lesion. So DD of dome-shaped opacity of the maxillary sinus. Most commonly asked question is the maxillary enteral polyp or maxillary enteral cyst. Okay, enteral polyp, not enterocanal polyp. You can see the convex upwards because this is solid substance, and cyst is the wall-lined structure. You can see frontal sinus osteoma here. Okay, mucosal is common in the frontal ethmoid complex, whereas osteoma is more common in the frontal sinus itself. In case of maxillary sinus malignancy, you can see the bony erosion and you cannot see the bony wall separating from the maxilla. So this is probably a case of maxillary sinus malignancy. The bone is being eroded over here. Okay, nasal bone fracture also is commonly asked question in the exam. The X-ray performed is plain X-ray, soft tissue, nasal bone, lateral view for fractured nasal bone. And there are certain questions to be asked in the exam which is beyond the scope of this presentation. Nasal foreign body also can be seen on X-ray, basically lateral view. And you can see rhinolith here. This is the rhinolith, which is seen in the right nasal cavity, and there are certain questions to be asked on rhinodeath also. If you like my video, please subscribe my channel Dr. Krishna Koirala for more videos like this. Thank you.